There are many cystic fibrosis-related conditions that might warrant or benefit from using different options for fertility treatment, as well as IVF or in vitro fertilization and ART or assisted reproductive technology. For cystic fibrosis, women who have issues with thick cervical mucus, where the cervical mucus has a high viscosity, can prevent sperm from going through and entering the cervical canal and impacting fertilization. There is an option called intrauterine insemination or artificial insemination, also known as IUI, which is a pretty straightforward, easy, quick procedure where the sperm is directly injected or inserted inside of the uterus, so it doesn't have to go through the cervical barrier to get to the female reproductive tract and be able to fertilize the eggs. Some other options include oral ovulation induction. So for women with hormonal irregularities concerning for lack of ovulation or irregular ovulation, sometimes we can help fix this by having them take oral fertility pills or medications. And this is also known as oral ovulation induction or super ovulation. There's also the option for IVF, which is our most advanced fertility treatment option, also known as in vitro fertilization. And this is a great option for women with cystic fibrosis who also have partners who might carry the genetic mutation for cystic fibrosis or might be affected with cystic fibrosis. For these couples, we can offer IVF with special genetic testing of the embryos. This genetic test is also known as pgt-m, which stands for pre-implantation genetic testing for monogenic disorders or single gene disorders. In this type of genetic testing, which is only done through IVF, a biopsy sample is taken from the embryos in order to assess the health of the embryos and screen for cystic fibrosis genetic mutations prior to transferring or putting back or implanting an embryo. And this way we can ensure the health of the embryos prior to implantation of the embryo and prior to the embryo transfer. Other options for women with cystic fibrosis might include considering using a gestational carrier or surrogacy. For women with cystic fibrosis who have severe underlying chronic illnesses and medical conditions, including poor lung function, poorly controlled diabetes, and a very low body weight and a very poor nutritional status. And in cases where carrying a pregnancy can be very risky for these women, there's the option for using a surrogate or a gestational carrier to carry the pregnancy.